Hello everyone, welcome to another session of IDS. Do you know that Indian healthcare industry is one of the largest industry in India? What does that mean to you and me? Does it mean that you and I tend to use medical facility more often than others? Well, in today's video, we are going to talk about Indian healthcare industry and we will try to find the answer of this question as well. But before that, let's try to understand what healthcare is. So, healthcare industry refers to the sector of economy that provides goods and services related to the treatment of patients with curative, preventive, rehabilitative and palliative care. When we are saying goods and services, it includes healthcare infrastructure, medical professionals, everything. Now let's talk about Indian healthcare industry. According to a research, Indian healthcare is working towards reaching USD $372 billion in 2022. Now this is a milestone and this suggests that there is a substantial growth in this sector. It is one of the largest sector of Indian economy in terms of both earning and employment, which reflects that there is increased spending on healthcare infrastructure, which has enhanced the quality of services to patients as well as created jobs for healthcare professionals. Now let's take a look at the components of the healthcare, which are hospitals, medical devices and equipments, health insurance, clinical trials, telemedicine and medical tourism. So all these are components of healthcare industry. Which are the factors which are contributing to the growth of healthcare industry in India? Let's take a look at them. Increased aging population. When there is increased aging population, that means a significant portion of population contains older people. Now, older people need more medical assistance. So, government has to expand medical infrastructure, train more professionals to cater to the needs of aging population, which drives the growth in healthcare industry. Growing middle class. India's middle class is expanding. Because it is expanding, their spending, purchase power is also growing. Middle class people can afford better medical facility. That also drives the growth in healthcare industry. Increased public and private partnership, or also called triple P model. It has significantly contributed to the growth. Why? Because it has made it so easy for government as well as for private entity to set up the hospital, train the professionals and provide services also. Integration of technology. Thanks to the technology, there are new ways of treatment which are available now, such as online consultation, telemedicine, which add to already thriving healthcare industry. Rise in lifestyle disease. Due to sedentary lifestyle, consumption of junk food and increased level of stress, there is a huge steep rise in lifestyle diseases also. Healthcare industry has to take care of those diseases also. So all these factors combined together are driving the growth in Indian healthcare industry. Now let's take a look at types of healthcare. There are three types of healthcare: primary healthcare, secondary healthcare and tertiary healthcare. Now let's discuss about them in detail. If we talk about definition, primary healthcare is the first level of care. It addresses initial medical needs, ongoing health management. So it's a basic care. Secondary healthcare is a specialized care, focusing on specific condition body symptom beyond primary care. So which means कि ये secondary health care जो है वो primary health care में included नहीं है. Tertiary health care is a highly specialized and advanced medical care involving complex procedures and treatments over an extended period. Now let's talk about who provides this kind of health care. Primary health care, it is provided by primary health physician or called general practitioner or family physician. Secondary health care is provided by medical specialists who specialize in that field, such as cardiologist, orthopedic surgeon. Tertiary health care is provided by medical specialists in specialized hospital or center. Let's try to understand different type of healthcare through example. Primary healthcare, visiting a general physician for viral fever or routine checkup or vaccination is example of primary healthcare. Seeing a cardiologist for heart-related concerns like chest pain, high blood pressure is an example of secondary healthcare. Undergoing heart surgery, organ transplant, intensive care for critical condition requiring specialized expertise and facility is an example of tertiary healthcare. Now look at these pictures. What difference can you notice? This is how most of the private hospitals look like, and this is how many government hospitals look like. Let's talk more about private hospitals and public hospitals. So if we talk about ownership and funding, public healthcare, it is government owned and funded, and it's government's responsibility to provide healthcare services. Because it is government owned, so it's government's responsibility. Private healthcare, it is owned and funded by private entities, and the responsibility to provide healthcare lies with private providers. What about accessibility? It aims at ensuring essential medical services are accessible for all. This is most important. Accessible for all, irrespective of financial status. This is what public healthcare does. Private healthcare, accessible primarily to those who can afford the services and may exclude those unable to pay, potentially leading to inequalities in healthcare access. This is the main big difference between public healthcare and private healthcare. Public healthcare is free for all, accessible for all, but private healthcare is available only to those who can afford it. Focus and service, public healthcare. Emphasis is on providing basic healthcare services through PHC, primary health centers. So here focus is that since it is accessible to everybody, everybody should get basic healthcare. Private healthcare focuses on providing comprehensive medical services including specialized treatment and procedures. Cost. Public healthcare generally have lower cost. Medical facility in public hospitals are subsidized or provided free. Most of them it is free only. जो भी होता है वो बहुत ही highly subsidized होता है. Private healthcare higher cost because of expensive infrastructure and medical equipments. Quality of care. Because public healthcare has limited budget, it impacts the quality and availability of the services. Patients have long waiting period and resource constraints. Private healthcare, it has usually have higher quality of care, shorter waiting time, better equipped facilities, or there is another factor which is somehow missing in public healthcare. There is a focus on patient comfort and satisfaction because they are paying such high fees. So they want their patient to be happy and comfortable. Staffing and resources. Faces shortage of trained healthcare professionals such as doctors, nurses. Pressure on existing staff can affect patient care and safety. Private healthcare, it has highly skilled staff, invest in advanced medical equipments and facility, better resources to meet patient need efficiently. So in today's video, we talked about healthcare industry, we talked about components of healthcare, we talked about the factors which is driving the growth of Indian healthcare industry, and then we talked about public versus private healthcare. Now is the time for your task. Do you think there should be a government policy regarding the charges levied by private healthcare? Support your answers with reasons. So that is all for today. I will see you soon. Till then, take care, stay healthy.